The Histoculture Drug Response Assay for Individualized Cancer Treatment. Histoculture is the three-dimensional culture of tissue fragments on a special sponge derived from pigskin. The sponge is called gel foam. The gel foam is soaked in culture medium to allow the tissues to grow. Tumors are taken from surgery or biopsy of cancer patients and are minced into 1 millimeter cubes and placed on the sponge. One sponge is placed in the well of a multi-well plate. Each sponge has 6 tumor fragments placed on it. A different chemotherapy drug can be tested in each well where there is a sponge with 6 tumor fragments placed on the sponge. After a designated period of time, the drugs are removed and the viability of the tumor pieces being cultured on the sponge is determined with the MTT assay. The viability of the drug-treated tumors is compared to the untreated controls. A chart is generated showing the percent inhibition of viability for each drug tested compared to the controls. Clinical trials have shown a correlation with drug activity in the HDRA for a patient's tumor and the patient's survival. High correlation of efficacy of drug response in the HDRA and survival of stomach cancer patients. High correlation of efficacy of drug response in the HDRA and survival of colon cancer patients. High correlation of efficacy of drug response in the HDRA and survival of head and neck cancer patients. The HDRA further demonstrates that cancer patients vary greatly in drug response from one another, even for the same type of cancer. The clinical trial data shown in this video demonstrate that HDRA can identify drugs that will either be effective or ineffective for individual cancer patients. For HDRA service, contact Anti-Cancer Inc. Telephone 858-654-2555, fax 858-268-4175, email all@anticancer.com.